with the oncologist, say the patient has already gone and they have either suspected cancer or have discovered a cancer, how supportive are the oncologists when they start seeing any kind of neurological symptoms?
Well, the oncologists are very focused in general, very centered in treating the cancer. So in many places, in many instances, the patient is not going to be seen by an oncologist unless the cancer is shown, demonstrated. So you can suspect, and even as a neuro-oncologist or as a neurologist, you can almost be certain that the patient is going to have a cancer, but what the oncologist wants is to demonstrate that where the tumor is to start the treatment. So in some way there is this, you have to have this talk with the oncologist and to come in agreement about multiple types of tests to be done, and meeting in boards with groups of people, tumor boards, groups of specialists of how to proceed with this. This is very important. When the patient is known to have cancer and is already under the care and the oncologist is already treating the patient, and the patient develops neurological symptoms, also I think it's very good to have this interaction with a specialist, with a neurologist. Many times I think that technology and tests are very helpful, but sometimes they can make things worse in some situations for not correct interpretation. And I've seen this in all the centers, in many situations, in that the patient is known to have cancer, the patient is treated for the cancer, the patient develops neurological problems, and instead of calling the neurologist, the oncologist runs a whole bunch of tests. An MRI is obtained. The MRI may show some abnormal finding, which has nothing to do with the disease, but is interpreted. The MRI is interpreted by a radiologist that doesn't see the patient, and in the report, this can lead towards a misdiagnosis, a waste of time. Mm-hmm. So in other words, in today, 21st century, and all modern technology, all these wonderful tests that we have, there is nothing that replaces a doctor yet. So you need an oncologist, you need a neurologist, or you ever need any specialty, they have to talk together.
Mm-hmm.